WHX Tech is a new launch for in pharma markets. It is basically a response to our partners and what the market has requested over the last several years, which is a dedicated event focused on health tech.
Welcome to the Health Enthusiasm Podcast, a panel discussion on innovations in health and self-care. My name is Christophe Choquet. I'm a health business expert, author, and professional keynote speaker. And every month I discuss with a panel of experts the positive change that are shaping our health and happiness. And this time we are at WHX Tech and I have just come off stage with a couple of experts talking about how healthcare will look like in 2050. And this is also what we will be doing in this podcast exactly. For this discussion, I have a panel of three experts, and they will briefly introduce themselves.
Hi, my name is Tamara Sunbul, and I am currently the Group CIO for Fatih Care Group.
Hi, my name is Justus Wolff. I'm leading several AI initiatives, and I'm on the board of scientific committees.
Hi, Christophe. Thanks for having us. This is Dr. Fatih Mehmet Gul. I'm the CEO of the Viv Hospital, Cedar Sinai, and pleasure talking to you.
Thank you. So how is it going at WH Tech? Well, do you like it? It's the first time that it's happening. What is your feel? What do you think about it?
I think it's fantastic because it's a great combination of different vendor solutions. Great to see multiple colleagues as well as world-class speakers here. So all in one, everything in one place.
I think the dynamic is great, and we have really needed such a conference here, so it's a great add-on for the region.
Tech event was something needed here. I have been attending to Arab Health for last 20 years, but then there were some tech companies and they were hidden somewhere else and it was difficult to find them. And Arab Health itself, it's huge. I mean, if you come to Arab Health, you lose your way, you cannot meet with the colleagues. Here, what I like, it's compact. And I can see only the tech companies. If you have interest to talk to them, there are amazing talent around. And as Dr. Tamara said, it's very easy to touch the colleagues wherever you look at. I can see now, even from where we sit, several friends around. So it's really going well.
And I also want to say it's been very nice sharing experiences across with different colleagues from different disciplines across the world. So I think that knowledge sharing really enhances the way we will deliver care in the future.
So let's build on that knowledge sharing. And I say with you, Dr. Sunbul, Tamara, we were on stage. We had to present our statements for Healthcare 2050, which is 25 years from now. All of us will probably be in dire need of health, or at least healthcare. So if you look at the future, we asked all of you to prepare one statement. What was your statement?
So my statement was, imagine a future where people won't be sick anymore and diseases will become irrelevant. Currently, we go ahead and we treat symptoms and signs of disease. We don't go back to the disease and treat the root cause. But now with technology, data, and being able to gather information from a person's genetic makeup to all the way from sensors all around him, we're able to create that digital twin and actually solve the disease from its root. So looking at a person and their genes, one same person might react to a medication differently in one phase of his life or another. And different people react differently. So if we really know a person's genetic makeup, as well as how those genes are expressed, we're able to solve chronic disease at the root. And nowadays, with CRISPR and gene editing, it's being possible. I'll give you an example from back where I come from. There's incidents of sickle cell disease and blood transfusion thalassemia. Those were diseases that required patients to be hospitalized, treated, and sometimes die from these kind of illnesses. But now, through simple gene editing, CRISPR gene editing, you're able to resolve those diseases and basically switch out those genes and be able to cure those diseases. So I'm looking forward to a future where chronic disease can be eradicated from its source rather than treating the symptoms and signs of a disease.
I think that's lovely, but how will we get there? I think it's a big leap what you're saying, right? So how will we get from where we are today to this future that you're predicting?
So nowadays we do gene testing, right? And if you do gene testing, it's like, wow, I've just done it. But in the future, we're going to be doing gene testing over time to see where those mutations happen or where the gene expression changes. Additional to that, we'll be collecting data from a multitude of sensors, whether it's from your wearables or from the sensors in the air or in your home. And we'll be able to put all that data together into what we call a digital twin. By the way, factories have had digital twins forever. So what are we waiting for in healthcare? Why isn't this something normal? So I think it's that acceleration. Things like toilets, right? We think of a toilet as something that you wouldn't even use as, but that in the future, that's going to be your lab testing. So imagine being able to detect diseases from just those sensors in your toilet. So those sensors all around, plus your genomic information, are really going to predict the future and help predict disease before it even onsets.
I love it. Let me just quickly challenge that. My steps today, the steps that I take every day, are not even in the health records. So how will we get from, the fact that my steps aren't even integrated in the medical health record? Will there be a medical health record in 2050 or not?
Great question. And I'll tell you how we're doing it right now in Fatih Care. It's a very simple integration. Don't you have a phone? Yeah. Is your smartphone attached to your wearable? Yes. You probably have Apple Health Kit or Google Health Kit or Huawei Health Kit. Guess what? Your EMR can actually pull that information from your health kit at one go. And then that information, you don't need to have clinicians are busy, the nurses, and there's no one to have time to review it. But imagine if you had an algorithm running in the background when you hit certain thresholds or things have changed, and being able to say, and put that information together with other data points it's collecting and say, okay, something is going on. You've not taken a step. Are you okay? Nowadays, with these simple wearables, you're actually able to look up pulse variability and be able to detect even if you're going to get sick before the onset of symptoms. So a lot of these things, recovery, early detection of illness and all that can be really simply done today, right now.
I agree. It's good to hear that you see a clear view and that's already happening in your hospital. I think it's one thing that what technology can do, it can give you a lot more information. I think the best way to convince physicians to use it is probably doing some analysis, looking at, where is this going? Is there actually some value in it? Can you prove that the data that you are generating is valuable enough for the physician? So is this, Dr. Justus, you are definitely busy with, looking at what data means and what the medical value and the economic value is of data. If you hear this future, is that something you want to be part of? And how would you see that happening from your point?
I mean, our panel was about the future in 2050. So we had to make some bold statements like what's the role of robotics and will it be more important than what we see right now? From my perspective, this is a crucial development that we see. I'm coming from the area of measuring the impact, may it be medically or may it be economically. That's where we did a lot of academic research on. So how do we really measure the impact of AI in healthcare? Because what we know is that in academic science, we know how to deal and work with AI, while in the practical world, there's too little. So we had to publish a lot on this gap, basically. And so it's possible to measure this outcome. And that's why, from my perspective, also the key decisions when or which tools to implement is driven by either the medical or the economic impact that it creates. Since the panel was about 2050, it was not only about software and AI-regulated software, how we use it now, it was also about the future of robots and how we basically see the development in 25 years. And there is, of course, a huge demand also for this because we see a shortage of workers, a more cost-intensive system and more patients. So this will play a big role.
Yeah. So there's a shortage of personnel and it is possible to solve it with robotics. Is the workforce ready to implement robotics? I know if you look at China, for example, China is if I may say so, in some way the factory of the world. They have a shortage of people that work in factories. So they're shifting rapidly towards robotics. I don't see that happening yet in healthcare, where basically we're facing a similar type of challenge. Are we ready to do that, or how do you look at these things?
I mean, these kind of technological shifts don't take place overnight. They are coming. And it's also, I mean, this is good and bad at the same time. They are not stoppable. Nobody asked here the medical landscape if they want to use AI, and now it's here. Basically, if you do AI in radiology or in image recognition in general, it's already widely used. Now it's coming also to other areas. I'm also quite involved in that. So I think one thing is really to see, okay, where is the demand, and then also where's the technological development shifting to. So this will come, and then it's our task and responsibility to deal with it well. But I'm pretty sure that it comes in any case.
Lovely. So we have more data, more insights from the omics. We have potential robotics that can help us, but technology can also do something else, isn't it, Dr. Fatih? What's your thought on things?
Definitely. I mean, as a doctor and then hospital manager, CEO for last more than 2 decades, technology should bring the human touch. And that's what we want to see. Technology should enhance the human touch, should enhance the engagement, and then we would like to get a better result out of that one. Today, what we see, lots of actually developments, new technologies coming, and every day I receive so many emails from the technology companies introducing their solutions. But what I have noticed, when these solutions are developed, unfortunately, they are not really studying the needs of the patient, the needs of the doctor, the needs of the engagement. And unfortunately, this kind of solutions are becoming more of a frustration rather than solution. So by 2050, what we would like to see is a simplified version of technology. I want to enter a hospital, if there will be, and I will not see any reception over there. And I will simply go direct to see my doctor. In the doctor room, there will not be any keyboard. I will sit with my doctor and I will have a wonderful free conversation. And before sitting with my doctor, I would like to have this connection, so then all the information, what I would like to share, will be shared when I'm still at home and did not reach to the hospital. So with this way, we want to increase the engagement. And even after the visit, we want doctor and then the patient to stay in touch. Today, unfortunately, we are seeing so many difficult things. In pharmacies, we're giving all the medication. Pharmacy counseling is something takes maybe 30 seconds. Take this after meal, before meal, this time, and go. And unfortunately, people do not remember all these things. So then the connection is lost. And that's why I have been studying the connected care. And I want to emphasize this issue. I want to simplify the technology and then healthcare actually blending part. So then people will see this as a regular thing in the life. Our generation, we have seen computer labs. Now the new generation doesn't know this. They were trying to teach us how to use the computer. But today, when you buy an iPad, give it to your child, you don't need to educate, because all these things have been developed in a human touch way. And we expect the technology, the digital health technology, to be developed in the same way, so that we can increase the engagement between patients, between caregiver, between community, between government and all others. So that is what exactly we're looking for. And we believe technology can bring human touch and make the life of the people easier and healthier.
I really like that. I remember on stage, we had this one question: how can people start today? So if I would ask you to, if we want to get to this human touch more, what do medical institutions, healthcare institutions, or even doctors themselves should start doing today?
Great question. Today in our hospital, we're doing something which I recommend to all other peers. We started doing something human touch gap analysis. We want to understand, when we bring a solution, are we disconnecting the caregiver and patient? Are we disconnecting our doctor from the care? Because unfortunately, sometimes we ask so many works to be done by the doctors in order to fill the claims, other kind of information, let's say the data for the MOH and then the others. And while we're using all these issues actually for consuming his time, we're stealing from the patient's time. And unfortunately, this way, the care balance is getting lost. So my recommendation today to all my peers is to start checking all these technology solutions from this point. When we offer an EMR to our doctors, make sure that it will be user-friendly. When you offer a solution to our patients, make sure that it is something every age could use this. So when you offer something, make sure that it will connect the patient to the hospital, not disconnect. And this is what I kept saying all the time. Today, we are proud we connected the surgeons from China to Italy. But what about the patient in the next street to the Italian hospital? Are we, having the connection things over there? Is this patient engaged and connected? Unfortunately, we have some difficult challenges over there at the moment.
Thank you. And thank you all three for your very enthusiastic views on the future. It all looks very promising. So I think my question to all of you is, Will people be healthier in 2050 than they are today or not?
Hoping they'll be healthier. I mean, I think with the technology and all, yes. But then remember, health is a choice. So we can't force people to make those healthy choices. So that question still remains open.
As I said on stage, yes, but not in all countries, because it's a question of how you steer and plan and execute on that. So, of course, this is a vision, but we right now, it requires a concrete implementation, and this will define how healthy the population is.
The answer is yes, because the healthcare accessibility will get easier, and then people will have more chance to reach to, if not doctor, to the healthcare information source. When we look at the ratio, there will be more healthier people than today, but not for everyone, unfortunately.
Okay, maybe one final question then. One thing that's been on my mind a lot is that 2050, hospitals, are they still there? How they will look like? What are your thoughts on hospitals and medical institutions?
So I think hospitals will cease to operate the way they are. They will probably be more critical care and more procedure based, and all the other stuff. Those are going to be part of virtual wards and hospital at home. Remember the old days, huh? When the doctor used to go around house to house seeing the patients.
Yes. I think they have a key role still.
Yes, the answer. There will be hospitals as a hospital developer, but then the shapes will be different. We will have, as Dr. Tamara said, more operating theaters and other things. But I have another theory here, Christoph. There will be physician technicians in future, because today, when we look at the future, we expect all this technology to use it, and then we will have some people to provide the examination to the patient, and they will add the examination data into the system. Today, this point is missing, and I believe in future we will see different kind of professions and titles which do not exist today.
Hi, Christoph. Avi here. I'm a physician by background based in London, UK. I'm the clinical safety officer at IBM, where I work at the intersection of healthcare and technology. I'm also the co-founder of Doctorpreneurs, a non-profit organization and global community for medical innovators and entrepreneurs.
Hi, Christoph. Thank you for the invitation. I'm a patient by background. So I spent 30 years in the industry, especially chemicals, pharma, and I left in 2018. And then I moved more into the healthcare space. I'm around all those, I'm an international speaker on healthcare in the metaverse, AI in healthcare. But before all, I'm around all those expert doctors, and I bring the patient voice into that.
Lovely. This is our first time at WHX Tech because it's the first time around. How do you like it?
Yeah, it's been a great, energizing few days. The first health tech event after the summer slowdown, so it's nice to kick off officially the next part of the season. And look, there's been so much energy. I think that one of the unique aspects of this event is it's brought together clinicians, innovators, technologists, policy leaders from across the world, not only the UAE. So we have, like myself from the UK, from Europe, Middle East, America and beyond. So I've had a really great time and definitely a bit low in energy now that we're at the end of it. So look forward to re-energizing when I'm back home.
So for me also, it's the first event, and again, I think it's a good kind of size and mix. And of course, I'm always a big fan of the networking. So there's no discussion about the networking, meeting old friends, new friends is always nice. But this said, that I think the size is good. The size of it, it's not too big, it's not too small. And you have the right expertise around the table together.
I fully agree. I think at many other events, you see somebody like crossing by and you say, oh, well, we need to talk. And then you never see them again. Here it was pretty chill. You got to be there tonight. Did you see you tomorrow? Okay, let's meet up. So that's a cool part about it I like as well. And also the concept was pretty cool. Now, the podcast will be about 2050. It's the moderator role that I took up on the main stage today. And you were on the panel, Dr. Avi Mehra. I'll ask to both of you one quick statement on how healthcare might look like. I mean, it's only a small part you can only mention, but what is the part of the healthcare in 2050 that you would like to see happening?
Yeah, it's a great question, and we discussed it a little bit on the panel. And an area I'm particularly passionate about is this idea that in 2050 we will really see the rise of sort of patient-controlled health and care, and healthcare will empower individuals with digital tools to take better control of their own health and care. And so for me, that is an area I think, we need to move in the direction of, to move towards a truly preventative care model, but also to reduce the pressure on the system and on physicians, because we recognize that we're on unsustainable footing in healthcare right now in terms of the challenges we're all facing globally, not only in the NHS where I'm based, but across healthcare systems globally, right? Rising demand, workforce shortages, workforce burnout. And so there is an opportunity to really rethink the whole experience and delivery of healthcare. And one big role of that is how do we empower every individual to take control of their health and care. And now we have the digital tools to be able to do that. But I would say it's not just about technology and digitizing existing services. I think what we really need to think about is how do we, redesign care around people's everyday needs and the rhythm of everyday life, and also reach the people that really need it the most, not only the digital literate or the digitally confident. And so I think there are still challenges to do that. I've got a few examples I can share from what we're doing in the UK, for example. So in the UK, we have the NHS app, which is our national citizen-facing healthcare application. It has over 37 million registered users, over 11 million active users per month. And today it is a very powerful tool in terms of individuals being able to book appointments with GPs, order a repeat prescription, access their health record and others. And so a lot of transactional services, but where it's really moving is quite interesting. Where it's moving, the vision for it is really to be a personal health companion for every citizen and true digital front door to health and care. But to do that requires not only technology, but also service redesign, cultural change, and educating people as to how they can use these tools to better manage their health.
Okay, so I'm not going to repeat what you just said. We are very aligned, both, so I fully agree with all what he said. And I'm just going to add on top of that, but it's the same point, I think it's about, we all talk about, moving from sick care to health care, but somehow, what does that really mean? And I think we have to become real in that. And I said, fully agree what you said. The app, everything is very nice. And the shortages, so the big shortages in HCPs, whatever we do, we are not going to solve the shortages. We are not going to have more doctors, more nurses. We even know that, 30% of the medical students in the UK, in the US, in Switzerland are not going to start as doctors. So we have to tackle it from a different point of view, which is what you said, the preventative care. And I give you an example from last week when I was in Copenhagen at the longevity event. And I was impressed, and I wrote an article about that, by a friend, a doctor from public health in Thailand. And what she actually said is that last year, the private hospital, Bumrungrad in Bangkok, they have treated 1.2 million outpatients in 1 year. So at the same time, the public hospital was treating 3 million outpatients per month. So, of course, they are aware that they will not solve the shortages of HCPs, being nurses, doctors, whatever. So what they decided is to come now to teach in the medical schools, the whole functional medicine, longevity with all the new stuff that's coming out there, so that the doctors are prepared, for more the preventative care and all the new things. Because, some doctors are out of the school since 20 years, so how they catch up with all these new discoveries, in the stem cells and all that, they are not prepared for that. So I had a talk the next day with her and I said, look, that's great. But at the same time, she mentioned, that Thailand, they like to eat, they say aroi makma and all that stuff. But that's not the issue. Their food is not so unhealthy. They may have quite some fried stuff, but the fish, the vegetable goods. So, and at the same time, you have this culture, this community, the family, where they keep the whole generation under one roof. So if in parallel, you start to do education in terms of nutrition, exercise, and all that in the family environment, combined with the new skills from these new doctors coming out of this new curriculum in school, I think we might be able to bring this longevity discussion from the bottom rather than from the top, where it's basically today it's for the rich.
I like that idea, and it's good to hear that you have pretty much similar opinions. Now, I want to piggyback on what you said and throw it into your hands there. Physicians are not ready yet for this type of future in 2050. How can we get there? I mean, how can we make sure, okay, there's the new ones that are coming in, but even curriculums very often are not yet adapted yet. So we will need to change the ones in the field today as well. Do you any idea of, because you work with a lot of medical innovators, so how can we do this?
No, it's a great question and an area, again, I'm very passionate about through the work I do with doctorpreneurs and empowering, again, clinicians who are interested in innovation, technology, and entrepreneurship, and again, equip them with the skills and knowledge. And I think, we are seeing change. It's not moving as fast as we'd like. I know a lot of this comes around education and the idea we need to educate. It needs to be part of the medical school curriculum, right? And there are strides being made, not as fast as we'd like, but that's where it needs to start. But ultimately, we already have clinicians on the journey today. Some who are early in practice, some who've been practicing 10, 15, 20 years, all with very different views, very different cultural backgrounds, and very different perspectives on technology and AI. And so I think we have to recognize that. But I think one big thing I try to do is harness those sort of clinical champions who are maybe a little bit further ahead, who can understand the potential of these tools and technologies and use them and their energy to help sort of educate and inform the broader community and bring them along the journey. Recognize this is not going to happen overnight. It's not going to happen in 1 year. It's a period of time this needs to go over. And we have to recognize there will be resistance to change for many different reasons. People don't like change, right? You've done something a certain way for so many years. And now someone says to you, oh, do that completely differently. Well, why? It works for me. And so we have to recognize the barriers, the resistance to change. But ultimately, I think as physicians, we also need to recognize that this is going to happen to us. So better for us to equip ourselves, go along with the journey and have some control over that. And so I do often recommend clinicians to get involved, be at the forefront of leading the change, understand the technology, be part of the solution, because we're seeing it's going to happen regardless.
Which I can imagine not that easy to do, right? There's a lot of technologies happening. They already have a lot of work, so it's challenging. And then we're only talking about technology. There's also what is happening outside of healthcare. There's also a mentality change that physicians need to undergo. Do you see this happening by 2050?
Yes, and I hope that it's happening before, but it's a long journey. I said we are not always, let's say, quick enough. And again, it's even the combination of healthcare not being always the quickest for good reason, risk management and all that kind of things. We talk about, the life of people, but also the combination with education, which is also not the quickest one to change. And we need radical changes, So I give you an example, everybody has heard about this kind of tests, that ChatGPT is more empathetic than doctors and all that. That's rubbish. The reality is that the doctors are losing empathy. So it's easier to be better than the humans because they are not empathetic anymore. 10 minutes visit, 70% of data entry and all that stuff. So you're losing the human touch. So my point is we should use AI to reduce, this bureaucracy, data entry and all that, so that the doctor becomes a human again. And even in education, and that's what I'm saying, unfortunately, it's not changing it quick enough. We should now teach critical thinking, cultural intelligence, emotional intelligence, even gut feeling, which is you cannot really teach. But we should now reinforce the human values and let AI do the rest. It's a tool for you to help you, from my point of view, to become human again.
We talked about this yesterday, I think. I largely agree with what you say, and I largely don't. I think humans don't have the monopoly on empathy. I think mimicking empathy will be super easy for machines, and they will probably be better at it than humans. I think what will make it interesting and why people will still want to talk to physicians, human physicians, is because of the human contact. I always say, and the human contact does not necessarily have to do with like empathy or good empathy or perfect empathy. It has more to do with the fact that you're talking to a human being. The perfect comparison is social media, right? We have a lot of connections, but are we really connected? And so that is what we will see with AI as well. There's a lot of empathy, but will it really be the human empathy that we want?
It's an interesting point, and I guess some of the observations we're seeing, right, particularly with the advent of tools like ChatGPT, and you can start to see how it's being used. And it's interesting where you're reporting. I know I sort of read an article about the top query for ChatGPT in Ireland is health-related questions. And then within that, a lot of it is related to mental health. And so actually what you're finding is citizens are going to these tools to seek advice as an empathy as opposed to going to the physician. And so we have to understand the reasons why they're doing that. And I think we've seen some of the cases in the news already where it's led to disastrous consequences, where, individuals have committed suicide as a result of, these interactions. And we have to recognize these tools are not medical devices, right? ChatGPT, specifically, it's not a medical device. I know there are tools being developed based on large language models, foundation models, that are going through regulatory approval to do similar things. But I don't think citizens realize that. And that transparency around, yes, these are very powerful tools and will be very convincing, and a lot of the time can get it right, but sometimes can get it disastrously wrong. And if users do not know that both the benefits and the risks, then they won't be adequately informed to use it. And same with physicians. We're seeing physicians using these tools in unregulated settings. There becomes then a dependence on the tool. And then you start to question your own ability. And when actually the tool suggests something and you think, okay, I'll go with that, and it's incorrect. And then who's at fault? The physician will be liable. So I think it brings broader ethical, moral questions into discussion.
So, Christoph, we didn't finish the discussion yesterday because somebody came, but it's okay, we disagree, and I think it's a point. I still challenge what you're saying because I think maybe it's just a question, what is empathy, the definition of empathy? And that's my point. I said, to be nice is easy. You can teach to be nice, and we know that by definition, ChatGPT is usually nice. It's not going into a fight, But for me, empathy is something else. If you start crying now, I'm not going to say, ChatGPT, stop crying. I might take you in my arm, and hug you and things. And I think that's the human touch I'm talking about. So for me, empathy is more than just saying some nice words. It's having feelings and all that. And I think that is not going to be replaced that easily. And maybe even if you can, I don't want to replace that. I want to keep that human touch, And you mentioned about the connection you might have on LinkedIn, on social media and all that. I'm probably have 60% of my connections, and I'm not going to give the number, I probably met at a certain time physically. And that's the difference. I recently met a former senator from Canada. We were connected since quite some time. And she came to Abu Dhabi and she was happy to meet me. We were both excited to meet each other. But the real physical meeting was 20 times stronger. We hugged each time, I don't know how many times. So that's what I'm saying. Even, you can mimic some stuff. But for me, at the end, I'm a humanist, and I want to reinforce that because in today's business and healthcare, which should be much more on the human touch, we are losing it.
I think we're saying pretty much the same with a different nuance, of course, and humans will be irreplaceable. What we have between humans, there's a certain energy, if you will, if you believe in that kind of thing. But there is an energy between humans, and you will never have an energy between a human and a computer. So I think 2050, people will have more empowerment when it comes to their health. Thank you for this discussion, Dr. Avi Mehra and Philippe Gerwill, my good friend. Good to have you finally on the podcast after 4 years, my man. Thank you both.
Hi there, I'm Megan Huffman. I'm the Vice President of Digital Health at Novant Health. We are a health system in North and South Carolina comprised of 20 hospitals and several outpatient clinics and ambulatory surgery centers. My role really at Novant Health is to develop a digital health strategy and lead us to execution of that strategy. I oversee anything from our Novant Health's virtual care network to leading our rollout of digitally enabled rooms of virtual nursing and a wide footprint of hospital-based digital care and virtual health, as well as remote patient monitoring and hospital at home. So I'm really happy to be here, and I'll turn it over to Dr. Mazen.
Thank you. So Mazen Gadir, I've been in the UAE for almost now 47 years, based out of Abu Dhabi and Dubai. I'm a director of healthcare life sciences in Alvarez and Marsal, and previously worked in number of other corporations in the government and PwC, Cerner, Dubai Health Authority, Abu Dhabi Healthcare Services Corporation. Quantum physicist by background, got into digital health by mistake. And I'm stuck here for 25 years trying to look at healthcare from multiple other angles. And I'm happy to be here with you. Thank you.
So, and this is exactly what we will be doing, looking at healthcare from multiple angles, because we're still talking about healthcare in 2050. So my question to you, Megan, is how will that look like? I know I don't want the exact picture, but I want one part of the puzzle that you think that might be happening or should be happening.
Yeah, I think the biggest thing is we've got to figure out how to meet patients where they're at and give them the right care at the right time. And so I think part of that is really being able to extend hospital at home and virtual care to our patients and have it to be easy. Patients need to be able to interact with their healthcare provider as easy as it is to ask ChatGPT or go look at a TikTok video. I believe that it's our responsibility to give them really good healthcare from healthcare versus getting it from tech or from social media. So I really think that 2050, I want to see integrated seamless care. And I want to see us not have to talk about virtual care as something separate, but as part of health. And that it is just the way that we deliver health. It's a part of it and not something that we see as something separate and different.
Okay, and so this will demand some change in the way that we work today. So how do we get there? What is needed from the people in the field today to get to that point that you want to go to?
Sure. I think there's kind of four big things. One of those is on the regulatory policy side. You know, in the States right now, we potentially, and on September 30th, could lose telehealth reimbursement and hospital at home reimbursement if federal law is not taken. And we are 5 years past COVID. So we've got to be able to get in front of our legislators and our policymakers to make sure that we can pay for telehealth and for virtual care. Because a lot of times if the ROI is not there, the incentives are misaligned and you're not going to see it. So I think that's part of it. I think the other part of it is we've got to make sure that we have education for our clinical providers. We've got to see virtual nursing being taught in nursing school. We can't expect that nurses are going to come out and we've got virtual nursing rolled out at scale. If they've never heard of it, that's going to be a huge lift on the health systems. We've got to start integrating that into our medical school, our graduate medical education. They've got to know how to function in a high-tech world, in a digitally enabled room, for hospital at home. How do they use technology as an enabling capability? And that is not something that comes naturally necessarily to our physicians. It's something that's going to have to be taught. I think another piece of this is from the patient side. We've got to keep patients in the center of this, and patients have to be able to trust their healthcare system, that they're going to get the right care at the right time. And we've got to bring patients along. You know, before COVID, patients were even still like worried, like, don't I have to go in? Don't you have to touch me? And we've got to do a better job of making sure patients know that we're looking at this technology not as a way to shortcut something or to replace physicians. We're looking at this to take better care of our patients and use the technology that we have at our fingertips. So I think that's a big part of it. And I think the fourth thing is really just, you know, kind of that interoperability and being able to kind of come together and be able to see the big picture. So I think that's the four things we're going to have to focus on.
Okay, let me add maybe a question that might be a fifth thing. I'm not sure. Because you were talking about all healthcare stakeholders. I can imagine there's stakeholders outside of healthcare today that might be going into that space. So is this something that is necessary? Is that a necessary evil? Is this something that will happen? Or is it something that even the healthcare industry would want to?
Do you mean as far as like digital health disruptors? Or?
No, even like supermarkets, car manufacturers, like completely tech companies that Google's, Apple, Samsung's. I mean, some of them are partially in the space. Some of them are looking into the space. Some of them are facilitating the space. But in 25 years, a lot of things can change. Google has a lot of data going on. So what if they would become some primary player in there? Are we ready for that? Are we open for that? Or do you see these things happening in that space?
I think we are seeing things happen in that space. You know, we have big retailers like Costco is offering telehealth visits now. And honestly, it worries me. I'm very concerned about tech companies really getting into healthcare. I think that healthcare belongs in healthcare systems. I think that we need to make sure that healthcare systems, though, are ready to disrupt themselves along with it, because patients are going to do the easiest thing that they can to get the care that they need. And if Amazon or Apple or Costco or whomever are the ones that are offering it, they're going to go there. And one of the things that we're focused on at Novant Health is really developing a virtual wellness clinic where we're going to do it. Why would we want our patients going to somewhere outside the healthcare system that has no idea about their medical records, has no relationship with them, and then when they do get really sick, they do come to us, and we're not part of that connected care. So I think it's the health system's responsibility to disrupt themselves and be competition to these tech companies, and I think that's going to force us to really have to move a lot quicker than health systems are comfortable with.
Dr. Mazen, any thoughts on this?
To be honest, I see Tesla and BYD coming into healthcare.
Yeah.
I see Emirates Airlines. I'm not going to say American Airlines because I think they're going on their way down, the U.S. airline industry. But I think Emirates Airlines and Qatar Airways will be your next healthcare players. In the Middle East, we're seeing retail coming into healthcare. We're seeing unusual players coming into healthcare, family offices that have been dealing with shipping and trade coming into healthcare. I think this region, specifically in the Middle East, since COVID, we have seen the rise of convenience, consumer convenience. And this has shook the healthcare down to its core. Plus, healthcare has become a national security sector, meaning that even in defense, they're going to indulge in healthcare. And you see the epidemic levels of burnouts that we see in the healthcare workforce. So the dissolving of your conventional way of how healthcare professionals are geared up and go through a conventional schooling mechanism is going to be disrupted itself. So I think there is going to be more disruption into healthcare. The fact that telemedicine might be out of scope because of the financial coverage, we have been suffering in the Middle East because telemedicine in countries like the UAE has been endorsed by government sector, and we are still yet to get the insurance companies to cover for it. So is telemedicine out of business? Again, we'll wait to see new industries and new players coming into it and commercializing it.
New models.
With new models. So that's again, I think, I'm a quantum physicist. 20 years ago, we were reviewing the use of nanotechnology and infrared imaging to put your usual conventional MRIs and X-rays out of business because that's damaging to your body. So what I see is that if we are to invest more in nanotechnology, this is going to open up a whole new industries and regulating healthcare and decentralizing healthcare away from its stronghold, the regulators or the healthcare professionals, and commoditizing and consumerizing healthcare, which I think it's heading towards there. It seems to us that even the concepts of drug discovery and the relaxation of drug certification and regulation has become also a mandate after COVID to speed up drug discovery. So we'll see. I think this is going to be disruptive. You might find food manufacturers producing drugs at some point. Or perhaps, like we said, we saw ventilators were manufactured by car manufacturers. The borders between healthcare and other industries have been disrupted and is going to be erased very soon, making healthcare like a jelly, disrupting other industries. Hospitality was the biggest benefactor of the healthcare pandemics because of the increase of bed capacity. So we see hotels now coming into the wellness and spas, right? So I think healthcare has become a hot property for other industries to engage and commercialize because of the strict regulations. And I think the ego that the healthcare leaders have for healthcare is being disrupted.
Yeah. And I love it. This is exactly what my two books are about. So that's why I was asking you this question as well, Megan, is to really know how we feel. And I love the way that you defended the industry and that you needed to improve to make sure that what you do is still good. But I do also agree with Dr. Mazen in saying that there's a lot of things happening. And I was talking to the organizers of WHX Tech here, and they asked me, what is the next big thing that we need to do? Where do we need to head to? And this was exactly what I said. You need to have Tesla here. You need to have car manufacturers here. You need to have home builders here because this is where it is going. I'm not saying that it needs to be a big stage next year, but within 10 years, they all need to be here because health to me is a universal, like a transversal business. It's not anymore a vertical business. And we should reflect on the fact that this is happening already. Doesn't mean that the vertical business will disappear, but it definitely means that the vertical business needs to think about everything else that is happening. Dr. Mazen, when you think about 2050, what would be a scenario that you would love to see, think you could see, or are afraid of seeing?
Look, at 2050, I will be, I think, 60 by that time. What I'm hoping for is we have nanotechnology being completely adopted within healthcare. That means that I can actually look at my vital signs, my kidney function using my nanowatch, right? I can have nanopills being swallowed, and they can do exactly what endoscopy does and more. I never want to be x-rayed or MRI'd, because that in 2050 will be old technology and harmful technology, right? I want to be in front of a camera that will show me my cellular structure down, if there is any cancerous cells, any sort of tumors. I can see that in front of me as if I'm seeing a Netflix movie, right? What I want to definitely hope to have at that time, number one, like we have now, the WhatsApp is connecting me with my family, is me connected with my integrated care coordinators. I can have my doctor, my lab technician, my radiologist, who's going to be a quantumologist, right? And they will be able to tell me if there is any cellular anomaly in my body as I move 60 and 65, and what sort of food dietary that I need to have. I think look at my digestive systems. I can actually monitor my wellness and my sleep, and that automatically goes into my nano dashboard that I can see within in my glasses. That's what I see myself in, data rich and able to connect with people instantly. Again, my late mother-in-law just passed away a few weeks ago because of a kidney transplant. And we were thinking, one of the questions that she asked, is there a chip that can actually be implanted in me to regulate kidney or to actually substitute the function of kidney? I think no longer we're going to have transplants. I think we're going to have chips, nano chips, that would actually regulate your organs in more effective way than having a transplant of an organ into your body. And I think we might be cracking that. And again, it's not far-fetched, but I'm hopeful with the advent of nanotechnology and the true concepts of quantum sciences. Quantum computing will enable us to unlock the real AI. What we are seeing now with AI is nothing compared to what we will see in 2050.
I love that idea. And Megan, I saw you smiling because you built one of the fastest virtual wellness clinics, if you will. Now you have some ideas to build that out, right?
Yeah, I love it. I think what we saw here in this discussion was really fun, is how deeply embedded I am into a health system and how not you are. But I think that this is the kind of discussion we have to have, because I think this is what gets us both out of our boxes a little bit more and be able to have these conversations. So yeah, my brain is already working overtime by kind of hearing all of this. So it's just really refreshing to be able to see someone not deeply embedded in the health system kind of give an outsider's perspective a little bit more on where they think things are going. And I'm with you. Like, I think some of that would be amazing, and I think we've got to get there, and I would love to see the technology get there.
And that's exactly why we're here at WHX Tech, right?
And I think, look, the new generations of doctors and nurses and scientists in the healthcare field will be the players of Roblox and, the PlayStation PS5 and PS6. So they will come with much more imagination. They will run hospitals like PS5. PlayStation could be running a hospital as a new entrant, right? The use of VR and AR would be a reality in 2050. So I think we haven't seen yet the real talent come out into the healthcare field yet, because they're in the making at the moment. They're playing Roblox. They're actually looking at cryptocurrency. They're actually dealing with games and PlayStation and, all the little game consoles. Those are the ones who are going to be our new doctors and nurses, who will have much more imagination to make my reality a true reality.
Yeah, and it's already happening in China. I mean, Tencent is the company behind one of the biggest games that I forgot now, the one where you dress up and you try to, shoot people down. I can't forget the name now. It was very popular a couple of years ago, and it's with these funny dances. But they bought hospitals. ByteDance, the company behind TikTok, has a bunch of hospitals. So that's not an accident that this is happening in China. So I fully agree. And again, this is why we are here at WH Tech, to learn from each other and see all these things happening, and to see how that is evolving. We are still at WHX Tech. I'm here with Mohamad Sabri. He's a Strategic Partnership Director of Informa Markets. Could you tell me more about WHX Tech, please?
Of course. Thank you for having me, and thank you for being here. WHX Tech is a new launch for in pharma markets. It is basically a response to our partners and what the market has requested over the last several years, which is a dedicated event focused on health tech. As you know, we have a very wide portfolio of healthcare shows, our flagship event being WHX Dubai, formerly Arab Health. Arab Health obviously includes the entire value chain of healthcare sector. And so our partners have been asking since 2 years now if it would make sense to put together an event dedicated to digital transformation within the healthcare sector and specifically health tech. So obviously we always listen to the market, we adapt to what the market needs. And after extensive research and assessment of the market, we realized that that is in fact what is needed. And you can see the result today. It's buzzing, everyone is busy, everyone is happy. So we responded to the market and it worked out. So glad we did so.
Are you happy with the result? If you look around, you were in the middle of the whole floor here in the investors lounge. If you look around it, what do you think about it?
Look, to be very honest, it has been a fantastic 3 days. The model that we are currently using for WHX Tech is slightly different than the regular trade shows that we deliver in the market. This one is more of a conference where the content and the connections is at the core of our proposal versus our different exhibitions where, you know, it's a trade show with content, with connections and investor programs. This one actually puts the connection program and the content at the forefront of this event, supported by the trade show factor or aspect.
So as a speaker, I can only applaud that because I love places where I can go and speak, of course. What has WHX Tech in store for the future? What should people be looking out for? I'm not saying don't make any promises, but maybe things you want to see happening or things that would be great if it could happen here.
Definitely. Look, going back to the first question, we spend a lot of time analyzing the market, studying the market, assessing, making sure that, you know, we minimize the risk as much as possible and obviously to adapt to what the market needs. We are very, very happy with the outcome of this event. Our partners, all the attendees have been giving us very positive feedback. Now we have to go back to the drawing board and basically take all that feedback and see, do we continue with the same strategy? Do we need to adapt, further modify? Definitely, I can see a very, very positive outlook for this event. We are going to come back with more features and providing better experience for our attendees. As to what exactly, well, you have to stay tuned and we will come to you very, very soon with the latest updates. But definitely, I can say for a fact that the investor program, the connection program, the content is a key aspect of this event. And this is where a lot of the investment will be going, hopefully.
And it feels good to be here. All the branding, the people, the organization, the spacing, the connection that we can have. I think it's been a while since I've had so many talks with people here. And I think that's one of the big things that you wanted to achieve. And to me, that was very enriching for me. Thank you very much for being on the show. And for all listeners, this is definitely an event to check out in the future. Keep an eye on WHX Tech. Thank you, Mohamad, Sabri.